help people understand fully what holistic and functional medicine psychiatry are. And so in this little video, I'm going to talk about first, the differences between a psychologist and a psychiatrist. And I'll also talk about what allopathic or conventional, or also called Western medicine, is relative to functional medicine. And then I'll talk more specifically about holistic psychiatry, which is what I define what I do. And within that is functional psychiatry. And I'll comment too on integrative psychiatry. So you've likely heard a lot of these terms, and I hope to make that clear what they mean. So first, what is the difference between a psychologist and a psychiatrist? So many of you will already know this, but for those who don't, a psychologist is someone who studies and is trained in psychology, the scientific study of the mind and behavior. So psychologists may specialize in clinical psychology, or they may do research, they may do psychologic evaluations, and their education generally involves 4 years of college, then graduate school where they're getting a master's or a PhD, or what's called a PsyD, a doctorate, a PhD, a typical PhD in psychology, or a PsyD is a doctorate specifically of psychology. And then they might have some postgraduate training. Psychiatrists, on the other hand, are medical doctors. So just as a surgeon would go to medical school, a gastroenterologist would go to medical school, your family medicine doctor or primary care went to medical school, all the medical professions went to medical school together, and then after medical school went off and got specific training in what are called residency programs and fellowships where they learn their specialty. So a psychiatrist is a medical doctor who specializes in the diagnosis, treatment, and prevention of mental health disorders. So as do psychologists, but again, this is more from a medical model. Treatment more typically involves prescribing psychiatric medications, at least at this time in history. Psychiatrists primarily prescribed medications to help with psychiatric symptoms. But if they're not doing therapy, then hopefully they're collaborating with therapists who are also treating this same patient. Education to be a psychiatrist is 4 years of college, 4 years of medical school, and then residency training to be a general psychiatrist is 4 years. If someone goes on to become a child psychiatrist, which is what I did, then you become a general psychiatrist and then you do a fellowship in child psychiatry, so that can be another year or two. So it seems that one would think that to become a general psychiatrist, you would first have to understand the early childhood development, neuroplastic changes that can occur in childhood that carry into adulthood, but that's not the case. The case is that psychiatrists are trained as general psychiatrists, so a very general education, and then those who are trained in child psychiatry go on and get further training. So I would say it's kind of a backwards model, but that is what it is. So I completed my training in general psychiatry and then child psychiatry 26 years ago. And at the time, there were still a pretty good percentage of us who were still doing psychotherapy in our practice. However, since 1996 through 2016, this percentage was cut in half. So in 2016, almost 10 years ago, it was only 21% of patient visits to psychiatrists involved any form of psychotherapy, and likely it's dropped even lower. And this has been driven by financial incentives, conventional psychiatrists, I should say, which isn't how I define myself, but conventional psychiatrists can see more patients if they're doing medication appointments because they're generally shorter than psychotherapy. And most insurance companies won't pay psychiatrists rates to do psychotherapy. They would prefer to pay the rates of other therapists who would not have as many years of education, and thus their fees would be lower. This is also driven by the shortage of psychiatrists. So let me switch gears. So now that we know what psychiatry or a psychiatrist is, I'd like to switch to talking about what is the difference between conventional psychiatry and other forms of psychiatry, such as functional, holistic, and integrative. And that latter is in the realm of the type of work that I do. So conventional psychiatry, or just to start, because it is a form of medicine, I'll just talk about conventional medicine. It's also called allopathic medicine or Western medicine. I'll stick with using the term conventional. So conventional medicine is a system of treating diseases and injuries using methods such as medication, surgery, radiation, and other what are deemed modern therapies. It relies on evidence-based practices, so scientific studies showing that these treatments are effective. It is the dominant system of healthcare in most countries, or in many countries, including here in the US, and it is what most people think of when they think of medicine. Generally, you have a symptom, you go to a doctor, you tell them about your symptom, they examine you. More often, they're prescribing a medication. You go home and you take that medication. When it comes to conventional psychiatry, the same would be applied, though, for brain symptoms. So someone has depression, they go to a conventional psychiatrist, they discuss their symptoms and the course of their symptoms, and the psychiatrist, more often than not, would be prescribing a medication. They may also be recommending psychotherapy, and the person leaves, takes the medication, may see that psychiatrist or someone else for therapy. In functional medicine, however, the focus of this type of treatment is to identify and address the underlying root causes. So while in conventional medicine, diagnoses such as in psychiatry become quite critical, and they are important in terms of communicating a constellation of symptoms. In functional medicine, it's more about what is causing those symptoms. What are those factors and how can they be impacted, as opposed to treating symptoms with a medication. And keep in mind, if you're a conventionally trained physician or psychiatrist, as I am, and if that's the type of medicine you're continuing to practice, I'm obviously oversimplifying. But for the most part, that is what is happening in conventional medicine, and even as it is defined. When I talk about identifying the root causes from a functional medicine standpoint, that is looking at things like genetic vulnerabilities, microbiome, the balance of gut microbes that can be contributing to things like inflammation or oxidative stress. That's where our antioxidant system is overwhelmed. We're talking about exposures to toxins, which can be from microbiome, but also from our external environment. And certainly history of physical and emotional trauma can also be adding into the mix. So these elements are identified and addressed, as opposed to, again, focusing on the actual symptom. Obviously, the intention here is to relieve the symptoms by getting to the root causes. And there's many tools that we have to help mitigate symptoms while we're getting to the root causes that, in fact, don't have to involve medication. So functional psychiatry, fittingly, is focused on identifying and addressing the root causes of brain symptoms, which are many of the topics that I talk about on my podcast and newsletter and here on YouTube. These things include things like nutrient imbalances that have been found to impact brain health. There's just a surprisingly small number that are really big players and that we test for. There's sources of inflammation, which can occur in the brain or be secondary to inflammation in the body. There can be sources of toxicity. While functional medicine and functional psychiatry are certainly scientifically based and draw from rapidly evolving research in the fields of genetics, epigenetics, the microbiome, oxidative stress, trauma, stress hormone pathways, because in functional medicine we consider the diversity and the differences in people The research is much more difficult. So in conventional medicine and psychiatry, the research might look at something like depression and what happens if you give 100 people with depression an antidepressant, and then you can see how many people respond to that. Now, from a functional medicine standpoint, you might look at 100 people with depression and think, some of those people are going to have depression because they have low zinc. Some will have depression because of methylfolate imbalance. Some will have depression because of brain inflammation. And we would be looking at how to identify why this person is having the depression and then addressing those root causes as a means of alleviating the depression. So that type of research is much more nuanced and complicated. And so these studies are much more difficult. Most people that have health issues of the chronic nature, such as psychiatric symptoms or cardiovascular disease, cancer, autoimmune conditions, have multiple factors aligning. So it doesn't mean all of the factors have to be addressed, but a number of them may need to be addressed for someone to really move to a place of healing. So under the umbrella of functional medicine psychiatry, you might hear the term nutritional psychiatry, and that relates to, again, these nutrient imbalances that affect the functioning of neurotransmitters, so the brain chemicals. And there are certain nutrients, there's dietary interventions. A great deal can be done in this regard to help people with their brain symptoms. Another element that falls under this umbrella of functional medicine would be environmental psychiatry. In environmental psychiatry, we're looking at the inputs, so things that are happening on the outside that are contributing to someone's mental health. Now, the obvious things would be relationships, trauma, stress, but less obvious to people are the things like mold toxins that people can be inhaling and contributing to mold toxicity in their body. It's extremely common. I see it very frequently in my practice. And another example would be sensitivity to electromagnetic fields. Increasingly, we're all being exposed to more wireless technology, and with that is coming greater inflammation, oxidative stress, disruption to the microbiome, all the things that I've referenced. So when we think about environmental psychiatry, it's really having a knowledge of how to address things like mold toxicity, EMF sensitivity. And though these are in the realm of functional medicine, they do require deeper learning. And over time, they're becoming more widespread, the understanding throughout functional medicine. So I use the term holistic psychiatry because on one hand, functional medicine can be very detail-oriented as far as looking at lab values. The treatment protocols can be complicated, again, because we're often addressing multiple root causes. This could be various nutrients. In some cases, it could even be medications like antifungal medications or things to lower inflammation while we're getting to the source of inflammation. It can also make people very vigilant about what they eat and about their environmental exposures. And so if this is left unchecked, I feel like for a lot of people it becomes highly stressful and can contribute to their illness. So my preference has always been to use the term holistic psychiatry to really balance some of that left brain detail-oriented science with the bigger pictures of healing. We need our left brain, which is detail-oriented, but we also need our right brain, which is big picture, and which is much more compassionate, much more embodied, and really helps if we take that type of mindset, our healing process can be much more seamless. I don't think it's one or the other. I really think we need to integrate both right brain and left brain perspectives towards healing. And I talk about this a lot on my website. So when you hear like mind, body, spirit, that's the case. I would say left and right brain. If we're using both of those types of tools, that makes us more whole. And for example, learning to embrace uncertainty, learning to feel at one with your body and not dominating it by trying to fix it. These are the holistic kind of approaches. We're not here to dominate our bodies. We're here to be at peace with our bodies, to feel safe in our bodies, to feel safe in our environments and in our relationships. And I just feel like holistic psychiatry embodies that much better. Lastly, let me comment on integrative psychiatry. Now, I don't use this as much. So integrative psychiatry is combining conventional approaches, so that could be psychiatric medication, and holistic approaches. And more often, when I see people identifying themselves as integrative, I don't often see them identifying themselves as doing functional medicine. So that's why I don't use that term, because I do functional medicine. I do functional medicine psychiatry, and I don't feel like integrative psychiatry really getting to those deeper root causes necessarily. There might be interventions that relate to lifestyle changes that have been well studied, dietary changes, meditation, exercise, but you don't see the nitty-gritty of identifying and addressing nutrient imbalances, balancing the microbiome, addressing sources of oxidative stress. And so that's why I would define myself as a functional medicine psychiatrist, but more completely a holistic psychiatrist. I hope this helps you understand the difference between all these terms, which can be quite confusing.